The Perfusionist Profession. Introduction to the Perfusionist Profession. Definition and importance. Perfusionists are specialized healthcare professionals crucial for supporting life during critical surgeries. Primary role: operating the cardiopulmonary bypass heart-lung machine during open heart surgeries and other major operations. Significance in healthcare: perfusionists are essential team members in operating rooms, directly impacting patient outcome during complex surgeries. Historical background of the perfusionist profession. Early innovations. Cardiopulmonary bypass and cardiac surgeries were initially limited due to the challenge of halting the heart. 1930s, Dr. John Gibson, development of the first heart-lung machine. Cardiopulmonary bypass evolution. 1950s, use of cardiopulmonary bypass to stop the heart while maintaining blood and oxygen supply. Expansions of perfusionist role to manage extracorporeal membrane oxygenation in ventricular assist devices. Milestones: first human heart transplant in 1967, showcasing perfusionist importance in complex cardiac surgeries. Evolving technology has increased perfusionist contribution beyond the operating room to ICU and critical care settings. Shit. Responsibilities of perfusionists: operating the heart-lung machine. Perfusionists manage the cardiopulmonary bypass machine, which takes over the role of the heart and lungs, ensuring the patient's blood remains oxygenated and circulates during surgery. Body temperature regulation. Perfusionists utilize specialized cooling and warming devices to maintain the optimal body temperature, which is crucial to preventing organ damage. Electrolyte and blood gas monitoring. Perfusionists continuously monitor and adjust electrolytes levels and blood gases to maintain patient stability during surgery. Medication administration. Perfusionists administer anticoagulants, anesthetics, and other medications required to stabilize the patient throughout the surgical procedure. Surgical team coordination. Perfusionists act as a key communicator with surgeons, anesthesiologists, and nursing staff, adjusting machine settings based on feedback and patient response. Procedures involving perfusionists. Coronary artery bypass grafting. Perfusionists ensure blood flow and oxygen delivery while surgeons work to bypass blocked arteries, preventing myocardial damage. Valve replacement surgery. Perfusionists support circulation while faulty heart valves. Heart transplants. Perfusionists manage the patient's circulation, temperature, and blood chemistry to optimize conditions for the transplant and reduce organ stress. Ventricular assist devices implementation. Perfusionists assist in the placement of ventricular assist devices, which are often life-saving for patients with advanced heart failure. Complex pediatric surgeries. Pediatric patients have unique requirements, often needing specialized perfusion protocols for surgeries on congenital heart defects. Equipment and technology used by perfusionists. Heart-lung machine. Core device that supports cardiopulmonary function during surgery by oxygenating and circulating the blood outside the body. Intra-aortic balloon pump. Used for patients with severe cardiac issues to help reduce heart workload and improve blood flow. Extracorporeal membrane oxygenation, a type of life support used in critically ill patients, both in surgeries and in intensive care to oxygenate blood and support breathing over extended periods. Advanced monitoring systems. Perfusionists use real-time systems for measuring blood pressure, oxygen saturations, acid-base balance, and electrolytes levels, allowing them to adjust the machine settings dynamically and continuously. Temperature control devices includes heat exchangers and cooling blankets to regulate the patient's body temperature to prevent hypothermia or overheating or hyperthermia. Educational requirements for perfusionists. Prerequisite education typically requires a bachelor degree in health sciences, biology, or a related field. Specialized perfusion training programs. Post-bachelor's programs focus on the cardiovascular anatomy, physiology, pharmacology, and hands-on perfusion techniques. Clinical training and rotations required extensive clinical training, often spanning a year or more, under the supervision of a certified perfusionist in high-stakes surgical environments. As far as the schooling for perfusionists are very limited. In fact, there's under 20 at the moment. Last time I checked on Google, which was 2 minutes ago, there is only 18 accredited perfusion programs in the US. And as far as the bachelor degree that you need to go to a perfusion program, it all de- it all depends on the perfusion program you're applying for. But the closest one to Florida is in South Carolina, and for that program, you can have a bachelor degree in any field as long as you complete their prerequisites and, of course, some other requirements which you can find on their website. You can apply for the perfusion program. Challenges faced by perfusionists. High stakes environment. Decisions are made in real time with immediate life impacting consequences. Precise monitoring of vital parameters under intensive surgical conditions. Blood coagulation control. Critical balance of coagulation and anticoagulation to prevent clots and excessive bleeding. Requires in-depth knowledge of pharmacology, especially anticoagulants and coagulants. Equipment and technical expertise. Operates and troubleshoots complex, sensitive equipment in high-pressure settings. Must remain updated on emerging technologies, techniques, and safety protocols. Physical and mental demands. Long hours and high levels of concentration are required. The risk of burnout is significant in high stakes environments like the OR and ICU. Ethical considerations in the perfusionist profession. Patient safety and informed consent. Ensuring patients and families understand the potential risks and benefits of perfusion-supported surgeries. Strict adherence to informed consent protocols, especially in end-of-life or critical extracorporeal membrane oxygenation machine use, ECMO use. End-of-life and life support decisions. Complex discussion around prolonging life with ECMO or withdrawing support. Collaborates with healthcare teams and families in ethically sensitive, often emotionally charged situations. Professional responsibility. Continuous commitment to safety and updated practices, including ongoing education and in evolving field. Accountability in decision making and monitoring during high risk surgeries.